Welcome to this episode of Let's Talk, where we zoom in on the practical implications and the next steps around the big sessions here in the Milan Congress. And in this episode, we're going to talk about digital tools in full arch rehabilitations. Is it a computer game or is it actually a game changer? My name is Gerrit Heijkoop and I'm very proud to be joined by the chairs of this plenary 3 session and also 2 of the chairs of this wonderful Congress. Luca Cordaro from Italy. Luca, welcome.
Welcome, thanks.
And also at our table, Luca Landi. Welcome as well.
Thank you very much.
Luca and Luca, let's start at the beginning. When we talk about digital tools and digital dentistry in a full arch rehabilitation, what's the main challenge?
Well, actually, there are several challenges. And the first thing is that these technologies have been introduced slowly since many years ago, and they are somehow updated year by year. And it is difficult for the dentist to understand when it is time to jump onto the technology or whether it is still a need to wait for the development and maturation of the technology. And to understand this, you need to base yourself on the experience of the other colleagues. I think Luca agrees with that, and also from what comes in the evidence. But at the end of the story, the evidence comes always a little bit late. Yeah. So people tend, I think, to listen to the experts on stage in these kind of events to understand whether it's time to do something or not.
Exactly. So it's IT tooling. IT develops fast. It's an investment, both in learning, as in cost, as in time, as in risk. So the dentist is on the edge or jumps right in. But then, Luca, we take it specifically in your session to a full arch rehabilitation. What is the specific challenge there?
Yeah, one of the challenges that those are sometimes very difficult cases to imagine how the procedure was going to look like at the end. And this is require really an expert to look at the case, to understand what's going on. And so the digital approach has the advantage of actually trying to foresee what's going to be in the mouth of the patient. Of course, you have sitting down in front of a computer. You have to learn how to use the computer, how to use the tools. But at the end, I think I agree with Luca that this is a tool. So we shouldn't forget that actually we are facing a patient that has to be individualized in the treatment. So we don't need to standardize the type of treatment. Rather, we need a standard of treatment. So using the tools may allow us to actually elevate our standard of treatment.
Exactly.
And I think that this is really the challenge, because the industry and IT is pushing towards the use of these tools. And the response of the market, of the dentist, seems to be going through standardization, using these tools in all the cases to come up with the same treatment concept and same treatment plan. And I think that this is risky. So
why is it risky?
Because patients do not need a standardized treatment plan. Patients need a personalized treatment plan because each case is different. If you pretend that you can treat all the patients with the same approach, you will end up in multiple failures because you will try to adapt the treatment concept to the patient. While it is, as Luca was saying, is exactly the opposite. You need to adapt the patient to what you want to do.
Exactly, and I can imagine, especially in implant dentistry, there's somewhat of a scale. Because when you talk about a relative simple case, single tooth, single implant, adjacent healthy teeth, it could be very standard and simple. Yet when multiple things start to fail and are needed, it gets more and more complex.
Definitely, and also because those type of treatment, as Luca was saying, really need to be individualized, and the clinician has a learning curve that's much higher than compared to placing one implant, and sometimes we tend to think that these things will simplify something that is complicated. But actually, to get and to make it simple, you really need to go through several steps that not all the clinicians have the time maybe or the expertise to do it. So sometimes, as you said before during the session, we're trying to actually to give the load to maybe to the lab technician because he learned faster the use of those tools without thinking that actually this is not taking away our responsibility to see overall the patient and this will not take away the risk factors of the patient. This is a tool, so we have to find the right patient to use the right tool in the right way.
And is that where the reference of the computer game comes from in the title? Because that surprised me. What does that mean?
Because I think that we were both very happy of organizing and leading this session, because this is exactly the point. I mean, if the industry is providing us with beautiful tools, then this is true and this is reality at the moment. We need to insert these beautiful tools into the clinical expertise, not the opposite. So it should not be the beautiful tool that somehow guides the treatment concept, because this would become, as I said before, very risky. And the reason why it is so important to have association like the EAO is that we can make this point to our colleagues, and we are considered reliable. So people come here, they can see the show, the computer game, but they also will understand what the limitations of the computer game and when to use it so that it is a tool. Exactly. And not a computer game.
Sounds like a warning that the software or the digital tool might simplify things, yet it doesn't execute you from actually still learning. I think it's a great analogy with the use of Google Maps, right? If you always use Google Maps, at some point you don't know how to find your way anymore.
You may lose your way, actually.
Right?
You don't find the bathroom in your home.
Exactly. What are some of the surprising insights or things you've seen in the session by your speakers?
Well, I mean, the two speakers were really outstanding. And Luca Cordaro and Sergio Piano, they present wonderful materials. I was really impressed by what Luca Cordaro was presenting in terms of the navigation system, because it's something that is presented in a reliable way, and even showing some limitation that is, of course, something that should be developed. So I enjoyed this. Was the part that actually surprised me, because I didn't think it was something that would be...
What was the novelty in the way he did the navigation?
Because he showed also glasses where you have an augmented reality. You can actually see the patient and the information at the same time. That actually in this system, sometimes you look at the computer, you don't look at the patient. So this is, I think, could be in the future a good breakthrough.
And I also think that the most important thing about the navigation approach that he showed is the fact that they somehow design the prosthesis before, but they're not going to manufacture it, because they will manufacture the provisional prosthesis only after placing the implants and taking the impression of the implants, and then they match the prosthetic design with the actual position of the implants, so there is no need to adjust the prosthesis into the patient mouth. And this is completely...
What does this mean for the timeline of the treatment plan? Is that an extra additional step, an extra visit, or can it be on the chair side?
No. This has an implication that you need to be able to somehow print or mill the provisional in your office or very close to your office. So it's another investment. But still, this is something that I think in the future might really be a game changer.
I can imagine.
Because you have the somehow ability to change a little bit the plans, because navigation is not static. And on the other hand, it's easy to have prosthesis that fits passively to the implants that you have placed.
Exactly. Same question to you. What is something that surprised you or wowed you in the session from one of the speakers?
Well, first of all, the quality of their presentation, they did really a great job. Second thing, the open approach that they had. So they were not like the expert of a religion. They were really trying to be open to discussion and discuss the limitation of each approach. I also liked a lot what Sergio showed, this stackable guide concept.
Stackable guide?
Stackable guide. This means that you can mount the guides one on the other. I cannot go into details here, because I saw this in the US years ago, and they were using it for another purpose. That was cutting bone, and this is something that we should need to discuss for maybe a couple of hours. But
another let's talk.
No, but he did it in a very smart way and clean way. So nice. I think it was very, very, very didactical for the participants to listen to the presentation.
Super. Let's look at the outcome then. What do you hope when either the viewers of the recording or the participants in the room today go back to the clinic next week? What do you hope that's one thing they do?
I think that they understand that if they want to follow this path of this technology and this digital approach, they require to give and devote time to learn how to use it, really. This is not something you can buy from a company and the day after you can use it, because this is really requires a learning curve. And seeing this expert actually discussing even the problems that they can have in approaching cases like this, I think is really something that is inspiring for all the people to understand that it takes time. You don't have to rush, and the other thing that, well, like Luca was saying, that you have really to standardize a high treatment and to personalize the fact that each patient has to be treated differently. So I think that this is the main message that came out from the session. Hopefully.
I think so. And one other important thing is that the two speakers were both private practitioners. So people that talk about reality, because these developments, of course, for normal reasons, are more implemented in the academia, and the academic world is, of course, they treat patients as well, but they have different times, they have different opportunities, different economical opportunities than a private practice. So I think that for the participants, it was very interesting to listen to one of their peers, their real peers, into the game.
Well, thank you very much, Luca Landi. Luca Cordaro, you made me very curious to go watch the full recording. I hope you as well. The two speakers on stage, Sergio Piano and Lucas Furhauser. It's a full 90 minutes of education based on science and practice. So I invite you all to go watch that and educate yourself further.